say I take my this pen and I kind of just tap on a balloon, and it's going to, just like this, not really going to do much. It's going to indent the balloon, but the balloon's going to be fine. And I take this pen and jam it in there, it's going to pop the balloon. It was the threshold which was making it, once you pass a certain threshold, it'll pop the balloon. It's the same thing with most physical things like ligaments, bones, everything. Like you can bang your hand or your arm, so a certain with a certain amount of force, no real problems other than some discomfort, or you can snap it in half. It's all thresholds. So, for example, when applying that to jaw joint issues and or teeth breaking down and or all of those things I was just describing, just like if you took a spoon and I did this to your tooth, probably nothing would happen as compared to really whacking it. So how can you bring a threshold down on somebody? Like say they can't for whatever reason or don't want to have anything in their mouth and any night guards. Is there anything I can do? Well, one thing that's common for clenchers is they're very, very loyal going to the gym. And what I mean by that is the muscles they're exercising are their masseter, their clenching muscles. And most nights these people go to the gym and they work pretty hard. And so if you look at pictures of, say, if you're one of these people, and you look at pictures, say you're 40 years old or older, and you look at pictures when you were 20, I'll bet you anything, your face was much slimmer in this area here. And you say, well, I've just gained a few pounds. Say, yeah, but it's not in your face. That's your muscles. You may have a little bit, but those are your masseters growing over time because you're working them out, and they're getting stronger and stronger until they reach this threshold where they'll start to create problems. So it's most common that patients will start experiencing these problems as they get older or after an accident and such, because that just brings, if you have a smash to your jaw and you physically damage ligaments, well, now you brought your threshold to damage way, 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 way down, and it doesn't take nearly so much. But let's just say a normal scenario is somebody just starts developing these problems over time. That's the main reason. So what can be done is we can actually make it so that we make these muscles weaker. And the only way I'm really aware of doing that, well, actually you could probably do it two ways. You could wire your mouth shut for 6 months and you're not using those muscles at all, although you still might be able to exercise them at nighttime. But really what you want to do is, in a realistic world, is if you put Botox into these masseter muscles here, what you're going to do is make it so that they cannot be as strong as they were without Botox. Just to give you a very brief bit of data on Botox, what it does is, you've probably heard about it a lot more for cosmetics, which is where people get it in their faces to stop wrinkles from forming, because the wrinkles form because when the patient smiles or raises their brows, the muscles contract and then you start getting these folds. And eventually, over time, those folds turn into wrinkles. So people don't like that, so you get Botox put into those muscles, and what it does is it sort of temporarily, partly paralyzes them, or weakens them is a better way to put it. It weakens those muscles so they just cannot contract as much. So patients for a cosmetic Botox will say, yeah, it's great, I don't have those wrinkles anymore when I raise my brow. And over years, those patients will start to, even if they've got lines in their forehead, they'll start to soften and go away, as long as they're having their Botox done so that they don't keep contracting those muscles. That's what Botox is doing, is it's just weakening the muscle. So I use that in the masseter muscle, just simply to weaken this. And what that will do is, now when that patient goes to clench at nighttime, they'll be clenching at a greatly reduced intensity. And then, so again, we're talking about those thresholds, so they don't reach that threshold, which is causing pain and the problems. And so that's really how I would use Botox. And again, there's always, what if, and for example, the next question would be, well, how often do you have to do it? And when do you know when to do it? And because typically, again, even for cosmetic Botox, is over time you can use less, and then it'll work longer for patients because these muscles are getting weaker. But you can't really tell that on your masseters. You just can't tell how hard you're biting or when you're biting really hard again, unless you want to wait for the pain problems, which now you're damaging things again. So you don't really want to get to that point. What I've done is I've actually created with some specific pressure sensors. I've created a little system where I can get a patient in, we measure how hard they bite. I say just bite as hard as you can, and we test it left side, right side. So now we have what's called a baseline of how intensely these patients are biting. We call it our real-time bite analysis. And then they'll have the Botox, and we'll get them back in a couple of weeks. And I like to see the intensity of their bite drop by at least 50%. And then we'll also see how they feel. And typically they'll say, gee, that feels really great. I don't wake up with this tenseness. My symptoms are gone, etc. So now we just say, okay, well, let's see you back in about 2 months, and we'll test you again. And what will happen is they'll either be starting to go up again, or they may still be sufficiently low, and we'll get them back in another month. As soon as we see them going back up again, they have another session of Botox. Initially, it'll be about every 3 months. Then eventually what starts to happen is it'll be every 4 months, every 6 months. Then we've got patients which are like every year now we're checking them, and they're still not getting back up to that threshold. So we've got a number of patients who've just effectively stopped their treatment with Botox because we brought their threshold down. And simply what we've done is we've stopped their body from going to the gym and working out as hard. They still go to the gym and will clench and grind, but just nowhere near as hard. So we have that threshold down. Everybody's happy. In many cases, I still like to see the bite being corrected, but the reality is you don't always have to correct the bite. If they're just on their Botox and they're staying on it long enough to get the muscle forces down, then that will often deal with the symptoms.